On the morning of April 30th, 1961, a 37-year-old Soviet surgeon woke up with severe pain in his lower right abdomen. He knew immediately what it was: appendicitis. Without surgery, the appendix would rupture, infection would spread, and he would die. But there was a problem. He was the only surgeon at Novolazarevskaya Station, a research base in Antarctica, one of the most remote places on Earth. The nearest doctor was over 1,000 miles away, across impassable ice. No rescue was coming. His name was Leonid Rogozov, and he made a decision that seemed impossible. He would remove his own appendix. This wasn't bravado. It was mathematics. Rogozov calculated his odds. Without surgery, death was almost certain. With surgery performed by his own hands, there was a chance. Not a good chance, but something. He spent the day preparing, knowing that by evening, he might not have the strength left to operate. But Rogozov's story isn't really about one man's courage. It's about something deeper, about what happens when human beings push beyond every limit we think we have, and about a question that has haunted medicine for centuries. How far can we go into our own bodies and still come back? Surgery, for most of human history, was butchery. There was no anesthesia, no sterile technique, no understanding of infection. Surgeons were closer to carpenters than physicians. They amputated limbs with saws. They drained abscesses with knives. Speed was everything, because patients died from shock. The best surgeons could remove a leg in under 3 minutes. Then, in 1846, something changed. William Morton, a dentist in Boston, discovered that ether gas could make patients unconscious without killing them. For the first time, surgeons had time. They could go slower, go deeper, attempt procedures that had been unthinkable. But a new problem emerged. Patients survived the surgery, then died days later from infections no one understood. A Scottish surgeon named Joseph Lister became obsessed with this mystery. Why did wounds turn septic? Why did surgical patients develop fevers and die even after successful operations? In 1865, Lister read about Louis Pasteur's work on microorganisms, tiny living things, too small to see, floating in the air. Pasteur had proven they caused fermentation and spoilage. Lister wondered, could they also cause infection? He started spraying operating rooms with carbolic acid to kill what he couldn't see. He soaked his instruments in it. He washed his hands in it. Other surgeons thought he was insane, but his patients stopped dying. Antiseptic surgery worked. And once it worked, surgery transformed from a desperate last resort into a precise science. By the 20th century, surgeons were attempting operations that would have been considered impossible just decades earlier. They opened chests. They repaired hearts. They transplanted organs. But one barrier remained. The surgeon and the patient had to be two different people. No one had ever successfully operated on themselves for something serious. The human body won't allow it. Your brain protects you from yourself. When you try to tickle yourself, it doesn't work because your brain predicts the sensation and cancels it out. When you try to hold your breath until you pass out, you can't because your autonomic nervous system overrides your will. Self-surgery violates something fundamental in how we're wired. The pain, the nausea, the psychological barrier of cutting into your own flesh. These aren't just difficult. They're supposed to be impossible. But Rogozov didn't have the luxury of impossibility. At Novolazarevskaya Station, as his fever climbed and his pain intensified, he briefed his team. A meteorologist, a mechanic, an engineer. None of them had medical training. He positioned them around the makeshift operating table in his small room. One would hold a mirror so he could see. Another would hand him instruments. A third would hold a lamp. He couldn't use general anesthesia because he needed to stay conscious to perform the surgery. He injected local anesthetic into his abdominal wall, though he knew it wouldn't be enough. The appendix sits deep inside. He would feel everything. At 9 p.m., he made the first incision. He described it later in his diary. Every movement had to be controlled. He couldn't see directly into the wound only through a mirror, which reversed everything. Left became right. Right became left. He had to work slowly, methodically, while pain flooded his system and nausea threatened to overwhelm him. About 30 minutes in, he felt something he'd never experienced in any surgery he'd performed on others. Weakness. His hands started shaking. Sweat poured down his face. He had to pause every few minutes, lying back, waiting for the dizziness to pass. His assistants watched helplessly. If he lost consciousness, there was nothing they could do. He kept going. He cut through layers of tissue, clamped blood vessels, searched for the appendix. It was hiding, tucked behind the intestines. He had to reach deep into his own abdomen, working almost by feel. When he finally found it, the appendix was already dark, swollen, close to rupturing, minutes away from killing him. His hands were trembling badly now. He couldn't tell if it was from exhaustion, blood loss, or the infection already spreading through his system. But he tied off the appendix, cut it free, and pulled it out. Then came the hardest part, closing. Layer by layer, he stitched himself back together, fighting to stay conscious. The entire operation took 1 hour and 45 minutes. When he finished the last suture, Rogozov gave his assistants instructions for post-operative care, took antibiotics, and collapsed. For 2 days, he drifted in and out of consciousness with a high fever. His team didn't know if he would survive. But on the 3rd day, the fever broke. By the 5th day, he was walking. 2 weeks later, he was back at work. News of what Rogozov had done spread slowly. Antarctica was isolated. Communication was limited. But when the story reached the outside world, it became legendary. Here was proof that the human will could override the body's most fundamental protective mechanisms. That training and knowledge could triumph over instinct and pain. But Rogozov never sought fame. He finished his year at the station, returned to the Soviet Union, and continued working as a surgeon for the rest of his career. He operated on thousands of patients, but never spoke publicly about the one operation that made him famous. He wrote a brief medical report, clinical and detached. He noted the technical difficulties, the complications, the unusual perspective, but he never described what it felt like. Maybe there were no words for it. Maybe some experiences exist beyond language. What Rogozov proved that night in Antarctica goes beyond medicine. He proved that the limits we think are absolute, the things we believe are impossible, are sometimes just boundaries we haven't been forced to cross yet. The human body has mechanisms to protect us from ourselves. Pain to stop us from going too far. Fear to prevent us from attempting the unthinkable. But when survival demands it, those mechanisms can be overridden. Today, surgery has advanced so far that Rogozov's operation seems almost primitive. We have robotic arms that never shake, imaging systems that see inside bodies without cutting, anesthesia so precise we can keep someone hovering at the edge of consciousness for hours. But no technology can replicate what Rogozov had: the clarity of mind to cut into his own body, the steadiness of hand to stitch himself back together, the refusal to accept death when the alternative was unthinkable. He died in 2000 at the age of 66 of lung cancer. Routine, ordinary, nothing like the death he escaped in Antarctica. His appendix, the one he removed from his own body in 1961, was preserved. For years, it sat in a medical museum in St. Petersburg, a small dark thing in a jar of formaldehyde. Physical proof that sometimes the impossible is just what we haven't been desperate enough to attempt. And somewhere in the history of human achievement, between the first surgeons who sawed off limbs in minutes and the modern machines that operate with millimeter precision, there's Leonid Rogozov, alone in Antarctica, operating on himself by lamplight, choosing to cut into his own body rather than surrender to fate. Not because he was fearless, but because fear is negotiable when the alternative is death.